Hello, everyone. Very pleased to welcome you for another episode of Gayatri Dialogues for Women's Health. And today we've got a very special guest. We've got Dr. Z, all the way from Cameroon, and who's been very generous with her time. And she's a medical doctor practicing in Cameroon with a focus on how to use digital health technologies to improve healthcare outcomes in underserved communities. And she also has a tremendous amount of experience in working in conflict zones. She's also the founder of Easy Health, which is, making precisely this change. It's a digital health platform, and what it basically does is makes healthcare solutions easy for people in these countries. So thank you so much for joining us, Dr. Z. We'd love to hear a little bit about what you do. Our audiences would love that. So if you can start with a quick introduction, and we'll get right to all the conversations we want to have with you.
Great. Oh, thank you so much, Swarnima. Thank you so much. It's such a pleasure for me to be here today talking to all of you. So, heading right into it, I'm Dr. Zyh Akumawah, as Swarnima mentioned. I'm a medical doctor. I was born and raised in Cameroon, and I presently work in the Northwest region. So, just a little bit of a background. The Northwest region presently has Northwest and Southwest regions, these are the Anglophone regions of Cameroon. They're presently experiencing a socio-political crisis, and it's left so many more than a million displaced, internally displaced persons. There are refugees, Cameroonian refugees now in Nigeria, and there is tension every day. So because of this, there has been a gap in healthcare access, especially for persons who are in these communities, like myself, because I'm actually living here. And for this reason, and with my background, I and a couple of friends, we decided to start or pick up an initiative which we named Easy Health. And what Easy Health does is we try to use any advancements in technology, no matter how basic they are, to try to reach or improve access to healthcare for patients in these communities. So what we do is we work with community health workers in communities that are hard to reach. And these community health workers are able to connect patients, especially women and girls in these areas, to Easy Health medical doctors via phone calls, via messaging. And when we do this, we're able to at least improve access to some degree to these women and girls in these communities. So that is what I do. And I also practice as a physician in a health center here in Bamenda. Apart from this, I'm also a Tech Women Fellow. That's the US Exchange Program. I'm a McCain Global Leader, and I'm part of the Young Health Program. So I'm really happy to be here, and I hope that whatever knowledge I have, or we're able to exchange whatever experiences that we have for a better healthcare future.
Thank you so much, Dr. Z. And as a fellow Young Health Program scholar, I'm so glad to be speaking with you and to really highlight the similarities when it comes to access, healthcare access in underserved, economies like ours. So you mentioned, that there is an influx of refugees. There is conflict and things like that. These are things that are changing the landscape of healthcare on a daily basis. And especially, when it comes to women's health. Now we see that you practiced healthcare as a physician and as an advocate for a number of years, and we've seen that in most places around the world, women's health is defined in a very limited way in terms of reproductive health, right? But
Yes.
we know that across the world, healthcare is much more than that. Women's health is much more than that. There are hormonal health conditions, there are autoimmune disorders, and we don't
Yes.
talk about that enough, right? So,
Yes.
what are some big issues that you see, women are facing in, Cameroon and adjoining areas, and what are some ways in which we can talk about women's health as more than just reproductive health?
Okay. Thank you so much, Selma. This is a very interesting take because truly, as you said, most times everybody equates women's health to just reproductive
Yeah.
health. But you also understand that we're having so many other issues apart from reproductive health. These may, I don't know why this is happening, or this may be because of the gap that usually exists when women are forgotten in these discussions. For example, here now we're in conflict. There are so many other things that are going on. Yes, there is the poor access because hospitals have been burned down. There is a deficit in even the equipment for these hospitals because they've all been burned down. You have staff that have relocated, and these patients don't even have access to to medical personnel, not to talk of medications, and not to talk of medications and maybe diagnostic tests, right? So there is a trend where we have some organizations, which is actually a good thing. We have some organizations coming to reduce this gap in reproductive health services for women and girls. It's good, and we are happy about that. But there are other things that come into play, especially for women who are aging. There is hypertension. There is diabetes, especially sometimes you have gestational diabetes,
Mm-hmm.
hypertension in pregnancy, preeclampsia. Some of the times these women are neglected, and and we are limited to sexual and reproductive health. We're limited to STDs. We're limited to or to young persons, things that are affecting young persons. I understand why they go towards that direction, but it would be good if we were looking at these things from a broader perspective, as I can put it. One of the barriers that we face right now is actually access to funding, because some organizations working strictly in reproductive health have easier access, not really very easy, but they have more access to funding for these diseases. But when you come to non-communicable diseases that are affecting women, especially ones that come maybe secondary to pregnancy, as I earlier mentioned, you have zero to like very little funding for them. And you have patients living from very far villages, walking and taking bikes just to come to the district hospitals or to come to regional hospitals to seek this kind of help. So, and apart from this, we also have, I'll just give you an example. In the Northwest right now, there are over 2 million people in the Northwest region, and there is no single mammography machine. There is no single mammogram. So imagine if anybody was even, let me say, remotely suspected that maybe you have a breast tumor. You have to go to the next region to get a mammogram. That is how difficult it is. And I'm living this experience right now because my grandmother was just recently diagnosed with the breast cancer. And we have faced all these challenges because just from suspecting to coming out with a diagnosis, we had to travel every time. And these are areas where there is a huge gap, but there is little to nothing that is being done. That
Yeah.
is being done. So I don't know if I answered the question, but I think these
Yeah.
are other areas, especially when it comes to non-communicable diseases among older women and younger women as well, that are not looked at. Everybody's talking
Mhm.
about STI.